welcome to another Social Security segment brought to you by CAN TV. My name is Maritza Alvarado, and I will be your host for today. I am currently a claims representative at one of the offices located on the north side of Chicago. And with me today is my co-host, Mr. John Marshall.
Hi, how you doing?
Mr. Marshall, can you take this time and introduce yourself to the public?
Yes, my name is John Marshall. I am the Chicago Metropolitan and Northern Indiana Area Working Centers Coordinator, and I'm also the SOAR Homelessness Coordinator. As the Area Working Centers Coordinator, I'm the point person for the agency to try to help other agencies and other service providers and advocates and people with disabilities themselves to help them, people with disabilities, to work if that's what they wish to do. I'm also the individual that coordinates at least one or two work incentive liaisons, technical experts that we have in each of the offices in the Chicago Metropolitan and Northern Indiana area. As the SOAR coordinator, I try to recruit organizations to try to help take our applications for SSI or Social Security Disability Insurance and the medical forms so that they could try to take those applications for homeless folks so they could help get them off the street. So ultimately, I do homelessness, I do try to help people with disabilities to work, and I'm the point person for that, for the area.
What's a lot do you do for the agency?
Yes, I do.
Well, what we're going to be speaking of today is retirement benefits, Medicare benefits, and if we have time, maybe go a little bit into the disability program. I just wanted to let you know that this is a live program, so if you have any questions pertaining to a Social Security matter, it doesn't have to be retirement, Medicare, it can be anything that you are concerned with. Give us a call. The phone number is located at the bottom of your screen, which is area code 312-738-1060. So a lot of individuals right now are preparing for retirement benefits. Some of them are looking forward to it, some of them are dreading it, but we are here to help you and guide you. So one of the eligibility requirements is for you to have 40 credits or 40 quarters. Basically, if you worked and paid into Social Security for at least 10 years, you have your 40 credits. Another is the age factor. And what is the earliest age a person can file for retirement benefits, Mr. Marshall?
It's age 62, but that is early retirement, and normally that takes a proportion of your full benefits off of your retirement check. But you have that for the rest of your life, as opposed to your full retirement, which is now at age 66.
Mm-hmm. And also, if you plan to file for your retirement benefits before your full retirement age, and like Mr. Marshall said, it's the age of 66 right now, your checks are permanently reduced and you're subject to an annual earnings limit. And the earnings limit is different each year. So this year, the limit is $16,920. So if you're working or not working and you're earning under that amount, you can apply for retirement benefits at the age of 62, but just keep in mind that they're going to be permanently reduced. If you wait until 66, you get the full benefit amount. Now, if you are 65, you're eligible for Medicare. Can you explain the enrollment periods for the public for the Medicare?
Well, when you become 60, at full retirement age, you become eligible for your retirement and for your Medicare, and ultimately you'll get your Medicare at that point. If you already have medical benefits, like if you have private insurance or you have some other type of medical benefits, you can delay getting your Medicare and then enroll at a later time. Like the general enrollment period is from January to March. The supplemental enrollment period is normally starts in November. But you have to have a good reason in order to apply outside of the general enrollment period of January to March. And normally that's when you lose your other coverage, that you could use that as a reason for filing outside of the general enrollment period.
Mm-hmm. And so like Mr. Marshall said, there is an enrollment period for Medicare. Usually it's 3 months before, 3 months after you're 65. But if you're 65 years old right now and you are currently working and you have healthcare coverage through current employment, you actually have the option to opt out of the Part B, and you can do that once you stop working. If you are over the age of 65 and you never enrolled for Medicare or for retirement benefits, then you would have to file for Medicare during the general enrollment period, which Mr. Marshall said is from January to March, and the coverage begins in July. But those are for the individuals that have not filed for a retirement check and are over the age of 65. If you're over the age of 65 and you're collecting a retirement check, it's automatically deducted from your premiums. Okay? Go ahead.
Now, by and large, when you have medical insurance with a private company, and they realize that you potentially are eligible for Medicare, they're going to want you to enroll for Medicare as soon as you can, because ultimately the Medicare is always the first payer in most of your medical services. So more often than not, if you have Blue Cross Blue Shield or you have any other type of private insurance and they know that you're about to get your Medicare, you're probably going to get a notice from them to apply for Medicare, so that they will be the first provider.
Now, if you have any concerns about retirement or Medicare, you can actually go on our website, and I'll guide you through that right now. That's our website. Our website is www.ssa.gov, and it gives you information on retirement and disability. I'll get to that in 1 second because I believe we have a caller. Caller, go ahead with your question.
Yes, good evening.
Good evening.
So, good evening. I'm 69 years old, and all I had was disability from my job, plus Social Security, and I'm on Medicare. I get it all. But I wanted to know, because I also get somebody that takes care of me every day of the week. But I just wanted to know if Medicare would be, or Medicaid would be better for me than Medicare, because I have a lot of benefits as it is. But if it's going to be better for me, yeah, I'd rather go on Medicaid. Do you understand what
Yes, I do understand what you're saying. In the state of Illinois, remember, Medicaid is a needs-based medical program and is administered by the states, even though it's covered under the title, I believe it's Title 18 of the Social Security Act. But but Medicaid in the state of Illinois, you have to have less income of $1,015 or less in order to be eligible for it. If you're over it, then you have to spend down, you have to come out of your own pocket to come down to that amount before you become eligible for Medicaid. It sounds like you have more income, you would have more income a month than that, and so you wouldn't be eligible for Medicaid in the state of Illinois based on your income.
Yes, you're right. You're right. I get Social Security, and I also get Medicare because I have a pension from my job. So I'm way over that $1,100.
Yeah, and see, the thing is that Medicaid, the thing about Medicaid is that, they will cover your doctor's expenses, your hospital expenses, and your medications. But again, it's a needs-based program, and you have to be under the level of that $1,015 in order to be eligible for it in the state of Illinois.
Okay, thank you so much for
You're welcome.
the information. Have a great.
You too.
So he brought up a good point, Medicare and Medicaid. We have a lot of clients that are confused with the two insurances, and like Mr. Marshall said, Medicaid is through the state of Illinois. It's offered through the public aid office. Medicare is actually through the Social Security office. Now, there are individuals who are over the age of 65 and they are collecting an SSI check. They have a medical card from public aid. They can actually have the state of Illinois pay their Part B premiums. But those are just recipients, SSI recipients that have an SSI check and they have a medical card through public aid. They qualify for that help.
Yeah, they will also, more often than not, if they have Medicare, then potentially they have Medicare, they have Social Security disability insurance as well, or Social Security retirement insurance as well. So, but that's like I was saying in the beginning of all this, is that, when you have when you're eligible for Medicare, they're normally the first provider. And the reason why the state will pay for your Medicare premiums is because Medicare is always charged first when you go to the doctor or your hospital last, or when you have anything like that. And then they'll be able to pick up the rest.
And so this year, the premiums for Medicare Part B are $134 a month. The Part A of Medicare, if you have the 40 credits, 40 quarters, you get that for free. The Part B, everyone pays for it, whether you have the 40 credits or not. And that covers doctor's visits and outpatient services. Okay, now, like I was saying, we have a website where you can go to get general information. It's www.ssa.gov, and you can come here. There's a section for retirement benefits, and it gives you all the information that you need. If you want to estimate retirement benefit, you can do that. If you want to know what your full retirement age, you can do that. They even have benefit calculators. If you want a publication, you can also request that on our website, which is pretty good. Another thing that our website offers is the ability to file for benefits on the internet. So you can see here, you can apply online, and it's faster, and you don't have to go to the office, and you don't have to wait for such a long time. Another thing that our website offers is the My Social Security account. And Mr. Marshall, what can a person do with a My Social Security account?
Well, they could do a myriad of different things. They could get benefit statements. They can basically change their addresses. They can do, a number of post entitlement things that they do that you can do in order to change your check. You're going to get another Medicare card. I mean, again, there's a myriad of different things that you can do with, on a My Social Security account, which is, the whole reason to have one ultimately is to be able to monitor what's going on with your benefits and what type of benefits you could potentially get, and to not have to come into the Social Security office in order to do routine services.
Mm-hmm. And the good thing about the My Social Security account is, if you want to see an earnings statement, you can get it through the My Social Security account. What you would need is an email address, and you would be prompted to create a password. Now, if you're filing for benefits, whether it be retirement, disability, or Medicare, you don't necessarily need an email. You can just do that online. But to create the My SSA account, you do need that email, and you need to create a password. Now, in regards to the Medicare, and we can go back to that topic, you do have to be 65. And like I said, not only do you have to be 65, you can also qualify for Medicare if you're receiving disability benefits. Is that correct?
That's right. But normally it's 2 years from the date of the onset of your disability that you'll be able to receive the Medicare. So there'll be a lag period of 2 years before you will be eligible to get your Medicare when you're on Social Security disability insurance.
Mm-hmm. Now, a question that I get a lot from our clients is, SSI recipient, they get disability benefits, and they want to know why they don't qualify for the Medicare if they're getting disability benefits through the SSI. Are you able to explain the difference between SSI and the disability benefits?
Well, SSI is a needs-based program, and it was taken nationally in 1973. It used to be a benefit that was administered through the states, and in 1973 it was made national, and it's based on need. It's based on income, based on your income, and based on your low resources. As opposed to that, SSDI, Social Security Disability Insurance, is based on you paying the FICA taxes. The FICA tax that comes out of your gross earnings check, that when you work, that's us. That's Social Security. And if you pay enough of that, right now I believe it's $1,300 is per quarter, and you pay enough of that, you can become insured for Social Security Disability Insurance. Now, in order to be eligible for Social Security Disability Insurance, you have to be insured at least 5 out of the last 10 years in order to be insured. And that means you would have to add those quarters up. And it's $1,300 times 4, what equals 4 quarters for that particular year.
Now, can you get both SSI and disability benefits at the same time?
Yes, you can. If your Social Security check is less than $755 a month, you're going to be eligible for both SSI and Social Security disability insurance, because the full benefit rate for SSI is $735 a month, and we disregard $20 of other income from other income before we reduce it. So that's why if you're getting $755 or less in Social Security disability insurance benefits, in all likelihood you're going to be eligible for SSI.
Okay. Now, I know that adults can file for a disability application, but can children get benefits through Social Security?
Yes, children can get benefits on supplemental security income based on their own disability and the income of the, and we're basing the income of their income and the income of their parents until they become age 18. Once the child becomes age 18, we don't care about the parents' income anymore or resources anymore. We just care about the individual's income and resources. And so, as a child, you can receive supplemental security income if your parents have low enough income and resources in order to receive it. Now, also as a child, you can receive benefits on your parents' Social Security disability insurance, or if you're a survivor of someone who's been insured for Social Security up until you reach the age of 18 if you're not in high school, or up to 19 even if you're in high school. Once you get past that age, you have to be disabled prior to the age of 18 in order to continue receiving those checks.
Mm-hmm. And that's correct. Now, the easiest way that you can file an application for disability would be on our website, www.ssa.gov. They do give you a link. It's pretty straightforward. Now, the processing time takes about 3 to 5 months. And the reason why it takes that long is because our doctors, they're located in Springfield, they have to request all the medical records that you list on the disability application. Now, if your claim is denied, you have the right to appeal. And how do they go about appealing a claim?
Well, ultimately, you can either do that online. You could do that online and actually file for reconsideration online within 60 days of the date of your letter, the date of the denial letter. And then we'll go back and we review the information to make sure that that you potentially, that you could be eligible. Keep in mind that we have a 35% allowance rate, on when you file the initial claim, and most of the time, when people get denied because we can't fit them within our medical criteria, within our medical listings, we ask 5 questions when we try to determine whether somebody's disabled. We ask, are you working and earning more than $1,170 a month? If you're not, then we ask, do you have a medical condition? And if you do have a medical condition, then we also ask if that medical condition meets one of our listings. And if it does meet one of our listings, if we can get all the medical information from your doctors and to meet that listing, then we say you're disabled. But if we don't get enough information from your doctors or from your counselors in order to try to meet that listing, then we have to ask the last 2 questions. Have you done any previous relevant work? Now, can you go back to your previous relevant work, or can you do any work within your geographical location? That is when normally people get denied. It's because when some of those answers could be yes. We have another caller.
Great. Go ahead, caller. What's your question?
Hi, I was calling to find out if you worked under another name when you were younger, how can you claim those benefits when you get ready to retire?
Well, the work that you do under in Social Security is going to be based on your Social Security number. Now, let me ask you this: were you working on? You say you were working under a different name. Were you using the same Social Security number?
Right.
Yeah. So if you had the same Social Security number. If you had the same Social Security number, and I take it that your name change was because of marriage, or you did or something else happened where you changed your name, we probably would need to look and see if you were the same person. Make sure that you were the same person, although all your work is going to be contained under your Social Security number. So when you file, you just give us your Social Security number, and then we can deal with all the
So the
different
other
name
number
changes.
that I worked under, I wouldn't get anything off of that, right?
Well, see, that's what I'm asking. Were you working under the same Social Security number when you were younger? That's what I was asking you.
I told him no. No, I wasn't working under the same number.
Oh, so you used somebody else's number?
No, I wasn't working under the same number. I had already told him that. Yes.
Okay, so what we would need both of those numbers.
It wasn't someone else's number. It was the number that I had.
You're only given one Social Security number throughout your lifetime.
Yeah, I understand that. But at a time when I was much younger, we could go to the Social Security office and just apply for another card, and they give it to us.
No, you'll get another card, but the number will be the same.
No, mine not.
It should. Now, if there's an issue where you have different numbers, then we need to get both of those numbers so that we can bring those earnings records together into the number that's actually yours. When you're assigned a number at birth, or when you first came to file to get a Social Security card, that is your number for life.
Okay, so I would have to go to the Social Security Board.
Yes, you would have to go, and then we have to get both numbers in order to reconcile which number is really yours and bring the wages over to it.
Okay. All right. Thank you.
You're welcome.
Okay, you're welcome. That's a good question. We have a lot of clients that come in stating that they worked under another Social Security number when they were younger, and they want to know if they can transfer those earnings onto their actual Social Security number. And usually we have to ask for a lot of documentation, because if it was work that was done in the 70s and the 80s, we hope that you save those W-2s, because we would need proof that you did work for that employer under that Social Security number. And that's why it's important that before you file for any benefits with us, that you take a look at your earnings statement, because you can resolve all those issues before you file, because if you file and we try to resolve it, your claim will be pending for a while once we rectify the record.
That's a very good reason in order to get my SSA account, so that you can be able to get to that earnings record and be able to deal with any other discrepancies that you might have before you file for your retirement.
Mm-hmm. And don't wait until the last minute. Try to do that beforehand, because it can cause a delay on your benefits.
Mm-hmm.
Okay. Now, continuing on with the disability, like you said, it takes, you get a 60-day period to file for the appeal. But do you have to have an attorney when you file for disability benefits?
Not necessarily. The only time where an attorney really would be, could be extraordinarily helpful for you was when you get to the third stage and you file for a hearing, because that is a legal proceeding. You are going to appear before an administrative law judge. And so in that case, you might need to have, legal representation in order to go through the process. But from the beginning, at the initial claims level or at the reconsideration level, is not necessary in order to have an attorney in order to deal with your claim. The main thing when you're dealing with any of these, dealing with your claim, is that when you file with us, I always recommend to everyone to also contact the doctors and contact the hospitals that you've been to, and make sure they give up everything they've got on you, because like I said, we have those 5 questions, and the third question is that, do you meet that listing? And if we get enough information from your doctors in order for you to meet that listing, that increases the likelihood of you being able to not only get Social Security benefits, but also increases the quickness in which we can be able to process your case. So ultimately, it's a matter of just getting the medical information, and us making the decisions.
Okay. So I hope we answered all your questions. Again, if you have questions that you weren't able to call in, you can go to our website, which is www.ssa.gov. You can also call our 800 number, which is 1-800-772-1213. We have a lot of information on our website. You can also go to any local Social Security office, and you can actually go to the website and figure out which office services your zip code. We are here every Wednesday from 4:30 to 5 o'clock. My co-host and myself wish you a very good evening, and we hope to see you sometime next week at the same time, 4:30 to 5 o'clock. Okay, so I hope you have a good evening.
Good evening, everyone.